Good morning and welcome to our virtual town hall today. I really appreciate all of you for not only joining us, but for the work you're continuing to do to support our students, our community, our employers, and perhaps in many cases, most importantly, each other as we continue to work through the COVID-19 crisis and the challenge that we all face. When we got together last, nearly 1,000 of you joined us for our virtual town hall meeting in May, and appreciate so many of you already having turned out today. Thank you for not only your interest in what's happening throughout the district, but your feedback and support and questions are just incredibly helpful. And it was clear from the last conversation that you liked the format as we talked about such things as returning to campus and as well as our progress toward becoming one college. And certainly both of these events are coming in increasingly close. If you can't tell today, I am back in my office, as are some of us, as we let's see, hang on, they're telling me my camera's off here, and I see that it is. Sorry about that. As we sometimes there are just challenges with the technology, and sometimes there are challenges with the user. In this case, it was the latter with that. So I apologize to all of you, although it's you'd probably rather hear my voice than my face anyway. See that. So, but thanks for that. But we are, as we move closer, now you can see that I'm back in my office, as are many of us today. And as we start really looking at how we continued on our journey to make sure we're doing whatever we can to meet the needs of students. And we have, as in the past, a number of folks joining us today. Dr. Justin Lonan, our Executive Vice Chancellor, is going to help guide the conversation. Dr. Iris Freeman, my Chief of Staff, who also is leading the district's mental health initiative. Dr. Linda Brady, President of Brookhaven College and our Interim Provost. Sherry Enright, our Chief Human Resource Officer, and Rob Winland, our General Counsel. Sherry and Rob are also part of a team leading some of our work around our return to campus planning, and we'll be providing additional insight during today's meeting. Additionally, we have two very special and distinguished guests joining us today, and I suspect that's who many of you have tuned in to hear. Dr. Phillip Wong is the Director of Dallas County Health and Human Services and has held that position since February 2019. Over the course of his career, he has served as Medical Director and Health Authority for the Austin Public Health Department and worked for the Centers of Disease Control as well. He's also a proud alum of Lake Highlands High School. Also joining us is Dr. Fred Cerise, who is the President and CEO of Parkland Health and Hospital System, has served in that role since March 2014. And prior to joining Parkland, Dr. Cerise served in multiple roles at the Louisiana State University Health Science Center and the Louisiana State University System. He also served as the Secretary of the Louisiana Department of Health and Hospitals. I want to thank both of you for joining us and sharing your insight and expertise with us today. And with that, we've got a packed meeting, Justin, so I appreciate everyone tuning in and look forward to the conversation. But Justin, I'll hand it off to you.
Well, thank you, Dr. May. And first of all, Dr. May, we've lost your video again, so I don't know if our production team is trying to tell you something, but join us back as you can. And then also, I know that Dr. Wong will be joining us here in a few minutes. But with that, we want to go ahead and get started, and really do appreciate everybody taking time to tune in again. We can see you again, so.
Okay, well, great. Well, I'm not sure. Obviously, somebody would prefer not to see me. So.
Well, you know, if you have to come down the hall, I have my mask handy and ready.
All right.
So come on down if needed. But anyway, with that, just appreciate everybody joining, and we'll go ahead and get started. And I'll start with you, Dr. May. It is June, as you said. We are now entering our third month of COVID-19, and we have largely been remote and working in that mode as we now focus on our return to campus. But Dr. May, in the midst of all of that, we know that there's also tremendous unrest and unease across the country on some larger issues, compounded perhaps by COVID-19. So can you kind of just share your perspective of where we are at this point?
Sure, and thank you very much. And certainly, as we're really thinking, continuing to deal with the COVID crisis, returning to work, and looking at, to some degree, some normalcy. We certainly didn't expect to be also dealing both in real terms as well as psychologically with the horrific events that have taken place across our nation. I referenced this last night, and I appreciate Chair Flores taking a moment of silence to remember the lives that have been lost. And I mentioned Breonna Taylor, Ahmaud Arbery, certainly George Floyd, but really all that came before them. And I would also like to just take a moment of silence in honor of their memories and the other lives that have been lost during, and just a reminder of the importance of social justice and what our country has always stood for. So let's take a moment of silence, if you would. Thank you. It's hard to talk about some of the events that have occurred. On one hand, we've had the action of police officers that have just exacerbated the feelings of anger, frustration, hopelessness that have brought our communities to a boiling point. And yet, I'm also highly sensitive to and respectful of those fine officers that, including the ones we have in the Dallas County Community College District Police Department, that are also appalled and frustrating and angered by what's taken place, and who dedicate their lives to serving our community. And yet the actions that took place, and particularly as we're thinking today about George Floyd, are absolutely inexcusable. And for so many people of color in this country, these tragedies have just become all too familiar. And really just reminding us of the systemic racial injustice that continues to exist throughout our country. And for others, certainly we don't think about this in many cases every day. And these tragedies serve as a jarring realization that as a nation that we just have simply failed to live up to the Constitution in our pursuit of a more perfect union. As community colleges, we are called to serve the people of our community, every single person. And I talk a lot about all means all, and that means serving all with respect, equality, and compassion. These words have significant meaning and really align with our mission that it precedes me, which is focused on transforming lives and communities through higher education. As educators and community leaders, we have a unique lens in which we view the challenges, and we understand that we really not only have an opportunity to facilitate some lasting changes, but we have an obligation to facilitate these changes and make sure that all of our community has the opportunity, all in our communities have the opportunity that they deserve. We take our role in serving communities seriously, and we consider the racial and cultural diversity of our college to be one of our greatest strengths. And it's the hope and strength we see in our students and employees every day is why we must move forward with a deeper love, and as I said last night, a deeper respect for each other. And also, we have to have increased equity in action, not just talking about it, but doing it. And learning and growing from this truly devastating situation so that we can emerge stronger and help make tomorrow a better Dallas for not only today's citizens, but future citizens as well. So, the question is, how do we harness the energy from this movement to create the change that we need to see? Honestly, I don't have the answers for all of it, but I hope that all of us embrace this opportunity to raise our voices and be part of the solution, whether it means asking ourselves some potentially hard questions about our own beliefs and biases. And I want to comment, just several people after my comments at the board meeting sent me notes and information of appreciation, but also information about how they were feeling and how they were dealing with this difficult time. And thank you for doing that, because it helps to understand the clarity, the lens from which you as employees of the district are dealing with these challenges, and to talk about the difficulty of the conversations that you may be having, and not only within your own family, but particularly with coworkers. You've talked about it with the clergy, community leaders as well. And I think that we have a great capacity to learn during this time and become better versions of ourselves, but also a better community for all. At the leadership level in the district, we're having some difficult conversations as how to address these deaths and the implications that they mean for all of us. And I want to make sure that this is not just some window in time that we're doing it, but how do we ensure that we're doing this in perpetuity so that these are ongoing conversations? How do we ensure that our curriculum is unbiased for all? Are our classes just teaching a different version of history? Or are we really teaching the history that is a more accurate reflection of our country and what our citizens have experienced? How do we make sure that our student services are fair and equitable? In the coming days, weeks, months, and years, we'll continue to address these questions. And I realize that this is a critical time for all of us, especially in the midst of our ongoing response to the pandemic. That's been hard enough. But I know that we're better together, and that together we can overcome our challenges and create a safer, more just, equitable society for all of us. So, I open it up like you've been doing with your questions and responses, but I challenge you again. Share your ideas on how we can make our district better. Let me know. Let our district leadership know. I really want to hear from you and get your thoughts. So thank you so much. Justin, I'm going to kick it back to you.
Well, thank you, Dr. May, for your voice and your leadership on these issues, and for committing that these are going to be continued conversations that we're going to have across the district. And part of the reason we do these town hall forums is so we can engage one another and have dialogue. And clearly, much of it has been focused on COVID-19, given the situation the last few months. And so, as Dr. May said, keep engaging with us and share your thoughts and your perspectives. Which leads me to you, Sherry. At the end of each of our town hall meetings, we've asked participants to participate in a survey to kind of share their thoughts. So can you share insights from our last town hall?
Sure, and thank you very much. This last survey actually did focus on employee engagement and how connected our employees felt to the district during the isolation of this pandemic. We had over a 61% response rate. And so we do appreciate your feedback. We listen to it, we look at it, and we determine how we move forward. For instance, over 94% said you felt connected to your work and your work group. which is highly impressive given that we are all in a work group sitting in our own living rooms for the most part, although we will begin coming back to our locations. And 90% of you said you felt connected to your manager, which is also wonderful that, you know, we are having those connections and making those connections in the time of this pandemic. And now, as Dr. May referenced, what's going on in the world. Likewise, two of you have said your work life has stabilized somewhat in the new normal. And overall, about 80% of our workforce has stated that the pandemic, quite frankly, has not affected their engagement at work and in their roles. So these results really do demonstrate your commitment, our employees' commitment to DCCCD and its mission. So we really do appreciate your feedback, as Dr. May and Dr. Lonan have said. There will be another survey following this town hall. It will be in a different survey format. I know a couple of you have had some issues assessing that. And the questions for this survey will focus on returning to our locations and back to our campuses and what that looks like. So I encourage you to continue to give us that feedback and provide us that very valuable information. So thanks, Justin, for letting me report on that.
Thanks, Sherry. Well, Dr. May, you referenced the return to campus plan as Sherry just did as well, and so we briefed the board on that a little bit yesterday at the board meeting, and Sherry and Rob and others who have been leading that team. But can you talk us through a little bit, you know, kind of the genesis of the plan and how it was crafted?
Sure, and thanks, and truly, you know, the plan was started. We really didn't have a roadmap. You know, while we've certainly been operating throughout the crisis, when we moved very quickly remotely without, quite honestly, the ability to plan much, we just had to kind of ready, fire, aim to get this done. And fortunately, we've got an opportunity as we come back to really think through this, because we knew the day would come. We didn't know if it'd be sooner or later, but when we would really need to get back into our facilities to better meet the needs of our students. And certainly it's going to happen with some students sooner than others, particularly those in classes requiring hands-on engagement. Many of our healthcare programs, many of our technical programs, that's certainly the case. So we did put together an internal committee made up of representatives across the entire district to create this plan. They've spent literally, I had to have been 1,000 hours or more collectively working on this, thinking through the details. And I just want to commend the group at the thought that they put into it. But I will say this, I also believe that as we get back and make that transition, we're going to be hit by things that we hadn't thought of. And therefore, the team, Sherry Enright, is always careful to say that this is a living process, a living document as we've designed it. So we've given that a lot of thought. The number one goal, obviously, is that we want to be able to meet the needs of students with keeping our employees safe, all at the same time. So we're going to be erring on the side of safety throughout the return process. As said, I'm back here, and really that's as much as anything to begin to test the systems, to get a sense of what we need to do. And even as we begin to bring a few more back next week, some of our leadership and others, we're going to remain flexible, agile, fluid. We won't hesitate to pull back if we run into snags in the process or things that we hadn't anticipated. So the input is critical, and another request from you is to provide input to us through the questions, through that, and take advantage of the opportunity to help us understand what's on your mind. And I really appreciate those of you that have shared your concerns. It helps us kind of frame what we need to be thinking about in order to ensure that we're not only thinking of your safety, but doing it in a way that that makes sure that you can trust us to keep that in mind as we go forward. So thanks for the question.
Well, thank you, Dr. May. And as you referenced some of the concerns that have come from employees, once we started talking about our return to work plan, let me turn to you, Rob, since you've been engaged in some of these conversations, and we may get into some of these issues deeper, but we've had several questions from employees that are concerned about safety and testing and sanitizing and logistics. So could you offer some insight for us?
Yes, thank you, Justin. And Dr. May and Sherry have already indicated that we had a return to campus team that was working on these issues over the past several weeks. And it really was a privilege for me to be part of that team. I think there were about 28 of us that were dedicated to this activity over the past several weeks. And we've, as Dr. May has indicated, we're taking a very deliberate, measured, phased approach to returning people to our campus. We have an obligation as an institution to meet the needs of the students and the communities we serve. We understand that. We take that obligation very seriously, but we also, we're dealing with something that's really unprecedented, and we took that very seriously as a team. I can't tell you how many hours, the Chancellor referenced hours, and I would agree with his estimation. There were at least 1,000 hours of time invested into this, and we had deep discussions, both at a large team level and then in subgroups, about the various issues we would need to address. And I have to be honest, we've discussed and thought about many things. There may be more things that will present themselves as we return in a phased and measured approach, but we were guided by some guiding principles that we thought were really important, and those are trust. We want our employees and our students and the community to have confidence in our ability to address these issues as we return to our campus and other locations. Safety is, as the Chancellor mentioned, is of paramount importance. We want to use all reasonable measures to make sure that people are safe as they return. Compliance is a part of that, and we've relied on best practices from federal, state, and local authorities, as well as other sources, to meld into our planning those best practices that are best designed to protect the safety, health, and welfare of our employees. And then we recognize we need to be agile, because this is a constantly changing situation, and there are certainly our esteemed guests can talk more about the medical realities of this than the lawyer can, but we have to be prepared to respond as we return. So we thank everybody for their work on this. We thank everybody as they return to bringing their issues to us. We're taking a phased approach because it's really a matter of numbers. We want to test our protocols with smaller numbers of employees as they return to make sure that what we've put in place is actually working and serving the needs of our community. So it was a privilege to be a part of it, and we're going to take a deliberate approach as we return to our locations. Thank you.
Yeah, thank you, Rob. And we're going to turn to our health experts here in just a minute. But before we do, Sherry, let me go back to you for a minute, because we have received several questions from employees that may have underlying health conditions, and they're concerned, and they want to know what the district's plan is to accommodate them.
Absolutely. And for those employees who are in vulnerable populations and with underlying health conditions, we certainly want to be as flexible as possible. As we move forward and more of our workforce is identified to return, there will be a process in place where employees can complete and submit a statement of inability to work. That will come directly to HR. It's not a document that will be shared, but it's for us to assist employees in determining who can remain home and who should in fact remain home. And again, that agility that Rob mentioned, the flexibility, we want to be as flexible as possible as we work with those employees returning, because we understand the concerns and the safety issues. So there will be a process in place for that, and we will be as flexible as reasonable.
Great, thank you. Well, now I want to turn to our two experts, which is probably the reason most folks have tuned in today. And so now we can hear from some real doctors, not us pretend doctors around here. And so, Dr. Cerise, I'll start with you. As you've heard a little bit about, kind of what we're thinking with our return to work plan. I know, running a a large system like Parkland, you've had to have similar considerations and, you know, have heard similar concerns that may be coming up from our employees. And so could you share a little bit of how you guys have approached that, some of the concerns that have come up, and how you've addressed them? And Dr. Cerise, you're on mute. You're muted.
There we go. Okay, thanks, Justin. I said you're getting closer to the real doctors, you know, but I'm still now I'm a couple of steps from. I had practiced for a while. I've been on the admin side, but we are, you know, we've been dealing with this now for a few months because in our setting we've had to come to work, and so we've, you know, if there's any good news out there, it is we've been active and we have not seen outbreaks among our staff at the hospital, and that includes, you know, the clinical people plus the necessary support people. We've had a lot of people working from home as well, but there are ways to do it and to address it. And so the things that we've focused on, and I'll reference, there's a great article in the New Yorker by Atul Gawande, Atul A-T-U-L, and he's one of the most respected minds in healthcare today, and he writes very plainly and clearly. And I'd give you that reference to look at. But he talks about sort of the 4 pillars of reentry and how we can address going back in, and the things that make a difference. Hand hygiene is critically important. Although if you look at what we've learned about how this is spread, and I've heard others reference, you know, we're gonna have to assess and reassess and modify as we go. That's certainly the truth here as well. As we get more information, it's not uncommon for something we said, you know, a couple of weeks ago as the rule. Now it's a new rule because we learned more, because we're learning as this thing goes. But hand hygiene is going to be important. So washing hands. There are studies that show washing hands 5 times a day will reduce respiratory infections by 40%. And you do it 10 times, it reduces more. And you have your hand sanitizer. So paying attention to that. Distancing is important because it spreads by respiratory droplets. And so the 6-foot thing is a real thing. And, you know, there's no hard and fast rule there, but that's based on how droplets, you know, project when people talk. So distancing, screening people, understanding that people are infectious before they show symptoms. And so if you, at least if you're asking symptoms, you know, have you had a cough, shortness of breath, loss of appetite, loss of taste and smell? Interestingly, those 2 are higher predictors of many of the other symptoms. We don't think about those as much. And then temperature, you know, you could do it or not do it. It's not a real sensitive indicator early on, but a lot of places will do that. But screening is an important thing, and people that are having symptoms certainly staying away. And then finally, wearing masks. You know, none of us are in masks today. We're all in our individual offices. But certainly, when I go out in the hall, I put my mask on, and we're wearing a mask, and that's very effective at protecting. It's protecting others from the droplets that I'm going to project when I'm talking and interacting. So those 4 pillars, I think, are important to pay attention to. And as I said at the outset, you know, as we've paid attention to that in our work environment, people are interacting here, and we're not seeing outbreaks.
Great, thank you, Dr. Cerise. Appreciate your perspective. Well, let me turn to you, Dr. Wong. Appreciate you joining us, and appreciate you've been a leading voice and have been on our TV screens. Appreciate your leadership in some of the county briefings. We can't see you on your video right now, so I don't know if it's turned off or not. But we appreciate your leadership in those briefings with the county, and so I want to turn to that for a minute if I could. Can you give us a general overview of the latest numbers and news regarding COVID-19 in Dallas County?
Sure. And again, and I want to acknowledge, you know, the great partnership that we've had with Dr. Cerise and Parkland throughout all of this, and with the entire community, the city. Everyone has really been working very closely together to address this. So, we report daily the number of new cases that we get reported to us, and as the health department, those are required to be reported from all the physicians and labs and things. So we report them as we get them. And sometimes there's some delay between when the tests were collected and when they get reported, depending on the processing of the labs. But, just to keep that in mind, yesterday we reported 257 new cases that were reported, brings our total case count to 10,719. And then we also reported 16 new deaths yesterday, bringing our total number of deaths in Dallas County to 245. But again, that has that same caveat, is that we're reporting the deaths as soon as we get them reported to us. Sometimes there's a delay, whether it goes through the medical examiner's office and things like that. But that, again, was also the highest single-day report that we've had. We've been looking at this data and monitoring it for weeks and months. We've been working with a lot of the modelers across the county, from different academic institutions, the hospitals, Parkland, certainly. The projections have been we'd be peaking around end of April, beginning of May. We've been seeing some of that, but what we've been seeing is it's sort of plateaued. And as Dr. Cerise mentioned, we really haven't seen it going up considerably, but we haven't seen it going down, progressively for 14 days either. Dr. Cerise and I have been working with the Public Health Committee that Judge Jenkins has pulled together that has been making recommendations, and I hope that everyone has seen that color-coded risk assessment and guidance document for the general public to really make decisions based on, where we are, where the experts see that we are. And, it's really on that principle, just because you can doesn't mean you should. And so a lot of things have been opened up with the governor's orders, but doesn't mean that that's what is recommended. And so following that, as Dr. Cerise mentioned, we're pleased that, because we've been concerned about how the opening up of things would affect some of these trends. Thus far, it's, again, stayed plateau. It hasn't, gotten exponentially increased or anything. And so we're monitoring that. We're still trying to see, because it takes a little delay to see some of the impact on, the indicators like new admissions to the hospital, new ICU admissions, those sorts of things. And so we're monitoring that and trying to assess, as things open up, when we can maybe move to orange. We've said we wanted to see 14 days of decline, but we're certainly putting that all into the context of everything. We're also trying to evaluate, given all the recent activity, the protests and crowds, what effects those might have. So it's a moving target, and we have a lot of people that are looking at this and trying to make the best recommendations they can.
Thank you, Dr. Wong. We appreciate you referencing the lag time and the color coding system, because we certainly had several questions around those, so that helps gives perspective. So really appreciate your insight on that. So Dr. May, let me turn back to you. Obviously, we've had some questions about where there may be increased cases, and that we may potentially have cases that come to DCCCD as more folks return to campus. So can you explain a little bit what our plans are to handle those potential cases within our own DCCCD community?
Sure, and important question, but I do want to go back to something that Dr. Cerise said a few moments ago, and that really is following the safety protocols, not only that we've laid out, but that's coming out of the county, that's coming out of the Center for Disease Control and others that are out there. The washing of hands, the wearing of face masks, the respect of that, even as and I appreciate Dr. Cerise pointing out that we are isolated in our offices now. Otherwise, I would have my mask on as we do when we're going in the building here. So we want to do that, but should a case occur, we have a district self-reporting tool that is on our website. We ask that whether it be an employee or a student, fill out that form. It goes into our campuses. The nurses specifically are evaluating these. If it's determined to be credible, of course, we're going to follow up with you as the individual, and we're not going to provide medical advice, but we certainly are going to help get you to a place where you can get assistance if that's necessary. We will alert our communications officer around the critical facts while respecting certainly individuals' privacy. We do want to notify anyone in the community, our community, that could have been exposed to that. We'll also report the incident through a web banner that will indicate anything that's going on so that you'll be aware of it that's out there. Our goal is not to overreact, but certainly we want to inform the community. As we said, our goal is to really be a trusted source regardless of what's going on. But we can only do that by relying on you, in this case as employees, to help us know if in fact that you may be experiencing symptoms. We are asking everyone to check their own temperature each day as you're coming back. Stay at home if you don't feel well. That's you know, I can't say that enough. I know folks are eager to meet the needs of students, but the best way we can do that in many cases is for you to work from home if you don't feel well, and to and while we evaluate where you are. So great question, and one that in each circumstance we want to be able to respond and answer on an individual basis.
Great, thank you. Dr. Cerise, let me turn back to you. You referenced a few minutes ago that you know, the medical field has kind of been learning as we go, as we learn more about COVID-19. And so we've had a couple of questions around that folks are curious if there's any new developments that you can share. And Dr. Wong, you may have something to add to that as well. And you're on mute again, Dr. Cerise.
All right. Thanks for the patience. So, you know, in terms of how the virus is spread, we've, you know, the focus has clearly shifted towards a strong emphasis on the respiratory droplets. We still know that it can be, you know, communicated by touch, particularly, you know, it can live on hard surfaces. And so we still are emphasizing wiping down of particularly shared space, those kind of high touch areas, doorknobs and keyboards and things like that. Particularly, like I said, shared spaces, hand hygiene, and not touching your face, which is a tough thing to do given just our habits. But that turns out to be, you know, a minor, a small contributor to the spread. And so again, the masking that's why the masking is so important, and paying attention to that. In terms of treatment, you know, we have participated in a number of clinical trials here at Parkland. We've had over 100 people treated with remdesivir, which is the antiviral drug. That drug, it was just published in New England Journal a week or so ago. The effects of the results of one of the first trials here showed that it does have some benefit on reducing time of hospitalization. The mortality benefit, there was a trend to improve mortality, but it was not statistically significant. But for moderately or severely ill people in the hospital, that reduced hospital stay by a few days. So it's not a cure. It's not, you know, something that we now can count on to say that we're out of the woods. But it looks like it could be beneficial. And we've used a few other, you know, we're participating in a few other trials, but we still haven't identified that there is, you know, a cure for this by any means. And we're waiting for, you know, for the opportunity to participate in vaccine trials as well, but we're not there yet.
Great, thank you. Let me also ask Dr. Cerise, while we're talking about it, we've had a couple of questions, and I know Dr. Wong's had to deal with this question a lot too, but we've had a few questions that people are saying, you know, as the shelter-in-place orders have been lifted, and people feel some degree of normal returning, the questions we've received are, have we learned enough about this virus to resume with everyday activities?
Well, I'll start and then Phil jump in because Phil's been working heavily on this. But, you know, the course that we've seen has not been, you know, you read it and you see the nice curves of, you know, the peak time. And as Phil said, we anticipated our peak would have been sort of earlier in May. And then this descent. And we just haven't seen that in Dallas. What we've seen is this sort of steady sort of plateau, may be trending up a little bit, but we've had this long plateau. And so you can understand people wanting to get back to their normal routines. And in some regard, some of that is dictated by the governor who has loosened some of the restrictions that the county put in place. Fortunately, we haven't seen a big uptick because of that. And hopefully people continue to pay attention to those, you know, those 4 pillars that I talked about: good hand hygiene, screening yourself, not going out and mixing with others when you're having symptoms, and then keeping a distance and wearing masks.
And let me add, yeah, I mean, one thing that we shouldn't underappreciate is how much effect everyone's sacrifice and everyone doing this has made, because we didn't see the big spike. We didn't have what was seen in New York. But again, I think there's sometimes some complacency that occurs with that. And we predicted, you know, if we're successful, people are going to say, hey, it wasn't so bad after all. But it was really because of so many people implementing those, you know, and the orders and all of this, you know, sheltering in place, it truly flattened the curve and made this impact. And, you know, as we said earlier, you know, some of the modeling, you know, we're not seeing further increases, we think, because there's still a significant percentage of the population that are, you know, still teleworking and doing physical distancing, that are wearing the mask. It's not 100%, and it doesn't have to be 100%. We want, though, as much compliance with that as we can, because that all slows down the spread. But people do have to be vigilant. And in terms of getting back to normal, we're saying there's going to be a new normal. Until we get a vaccine, until this is really over, there is going to be some new normal. I know we've had internal conversations. Is the new normal that everyone's going to be wearing masks all the time? You know, well, it certainly, you know, could be. I mean, that's something that's something out there. But certainly, everyone practicing these preventive measures will be important until we have something like a vaccine or out there.
Well, Dr. Wong, you mentioned masks. Let me just ask. We've had a couple of questions about masks and about the type of fabric or material that's most effective, and if there's any negative long-term effects from wearing a mask. So, any thoughts on that?
Yeah, you know, and people you know, ask about that because the original recommendations weren't for the general public to be using those. Certainly, it was, you know, so you don't want to use the hospital-grade mask because there was a shortage of that. But what, you know, changed things is that increased recognition of how asymptomatic spread, people who don't actually have symptoms even, could be transmitting this. And so that if everyone, it's not to necessarily protect the wearer, but to prevent if someone has asymptomatic carriage, that they won't then spread it to other people with their droplets. So that's where, I mean, there is some research in terms of the filtration effects of different cloth masks, you know, the particle sizes. Again, there's, you know, there's more technical data on the particle sizes and things. But I think some of it, the studies I'm seeing, generally available household materials that can have like a 49 to 86% filtration rate. If you can get, you know, so there are different materials that can decrease the droplet spread based on what you're using. So, you know, certainly some of the tighter woven materials would have better protection of that droplet spread. But, you know, what we're seeing is that any of that can really help decrease further spread, particularly from the asymptomatic persons spreading it to others.
So, Phil, wouldn't you say, like, the most important thing is, if you're going to be out, if you're going to be mixing with people, have something, you know, if it's a surgical mask, that's fine. That's good. That's going to be a little bit better. But if it's a cloth mask, that will decrease a lot of the spread as well. And so the important thing is being consistent and having something on. And if we're all consistent and if we have a large penetration of that behavior in the community, we really will keep this thing down.
Yeah, absolutely. And that's what, again, what we're thinking is some of why we're not seeing the big spike of what we, when things have been opening up. And, we're hopeful that that helps things be able to open up more safely, perhaps, if everyone really adopts that.
So, Dr. May, hearing all of that, and as you think about our return to campus plan, can you envision a time where employees and students might all return to campus, and what that may look like?
I do, and it's kind of interesting. I don't know what that's going to look like, and I don't know the timeline, and I know there's a lot to be figured out. But looks like we lost cameras again here. Hang on, sure where they go off, but hopefully back. It's kind of interesting. I'm about halfway through a book by John Barry. You may know him, Dr. Cerise, and called Influenza. And one takeaway from that is the science work that's going on, the research right now is absolutely, I'm convinced, going to help us figure out the vaccine and the way to deal with this going forward. And certainly part of that is waiting a bit on the testing and the vaccine, but it's going to happen. And I'm convinced, and thanks for hospitals like Parkland and others that are participating. Hopefully the trials will come soon. But along the way, we're going to make the right decisions to be respectful and look at individual needs and concerns. But I also am very comfortable that we at some point in the future. Don't ask me the timeline. I don't know. We're waiting on a lot of people smarter than me to figure out how we will be able to do this completely safely, but I'm convinced it's going to happen.
Well, Dr. Brady, let me turn to you. As we know, course delivery is going to look a little different this fall, largely, and as we previously announced that we were primarily going to be online in the fall. So can you give us an update on how courses that meet in person may do so safely, and kind of what you think that's going to look like?
Sure. We have students coming back to our campuses next week, in fact, to finish up incompletes from the spring. The Student Academic Success Task Force has been working with the Return to Campus Task Force to establish protocols in accordance with CDC guidelines. And so, for example, we've been working with our facility staff to identify the number of students who can be present in each classroom or lab space in accordance with CDC guidelines, and program faculty in each CTE area have been working on the details of delivering this in-person instruction. I think, is my camera off? Okay.
It is.
Yeah.
You're still coming through. We just can't see your smiling face.
Right. So the CTE faculty have been working on the details of delivering this in-person instruction. We're also looking into technology that can be used to ensure that students stay 6 feet apart, but they can still sort of see what's going on when the faculty members doing demonstrations on equipment. So all of this work that we're doing right now to finish up our spring incompletes will inform what we do in the summer and fall as well. So we're working to determine if there are there may be other courses besides those in CTE programs that require some in-person instructional time on campus. So we're working on that right now too.
Great, thank you, Dr. Brady. Dr. Freeman, let me turn to you and kind of, I know you've been working with our student success team and also focusing on our mental health initiatives. So share with us a little bit, if you will, hearing all of that as people think about coming back and returning, employees and students, what kind of resources are we going to be providing, certainly to students, and any, mental health resources as well?
Well, as I think about it and I hear the discussion, I reflect on some of the emails that have been sent to the Chancellor. Sharing information and having constant communication has really been settling to our employees and our students, just for them having some knowledge to ease their minds. Because as we return to our buildings, the reality is our work routine, our school routine have and will change in some form or fashion, which is uneasing to people. They're fearful, they have anxiety. And so we're trying to turn many of our resources for our students and our employees in the same direction. We have a resource page available for employees. It's the wellness resource page that's on SharePoint, and it provides direct links to information for our benefits with our employee assistance program. And there's self-help modules for employees to utilize to help with some psychoeducational learning. And as we finish this town hall, Sherry and I will be attending a meeting with UT Southwestern on how do we roll out the Vital Signs 6 online mental health screening and referral program for our employees. Along with that, I wanted to make sure that I share that on our resource page for employees, they can go and check out some videos that will be, you'll have to register for them, but they're through our employee assistance program. On June 10th and June 18th, there is a webinar called Finding Value in Your Role, and it is intended to help with employees as they return to work and return to their buildings or what have you. And those are the kinds of resources that we're providing for employees and supporting them. And with our students, we have similar support for them. Our counselors are offering, and our care teams are offering telehealth modality available to students so that they can have that one-on-one individualized treatment along with some group sessions available for them as well. For the sake of time, I just want to hit a couple of things that I think are really important as far as students having mental health forms that are available to them, and our care team and counselors are working in a different way with our student services departments to make sure that we are specializing in our meeting our students' needs culturally and being sensitive to some of those cultural differences. And just with the times that we're in with the slow burning stress and the crisis that we seem to be experiencing on a daily basis, to make sure that we are providing relative support as we lean towards mental health support.
Thank you, Dr. Freeman. And appreciate your mention of the time. We are going to have to kind of go into the lightning round here a little bit, and we've had several questions come from employees. Dr. Wong, let me turn to you. One of the questions was about ventilation and AC systems. How likely is the virus to spread through the air while inside the building versus outside with fresh air?
Yeah, well, definitely outdoors and fresh air is better than indoors. There have been some studies showing how the ventilation can affect spread. I think there was the study in China in the restaurant where the ventilation system did contribute to the spread. So, ventilation is certainly an important aspect of that, avoiding recirculation of air. Some of the things, having air cleaning, UV light, and disinfection are some of the environmental and facility type of cleanup and things that are out there to try to reduce that. So, it really is that's also part of the, the physical distancing, minimizing the number of occupants in some of these indoor settings are part of that, because it is certainly one aspect of transmission is, that is still being investigated, but as there are, recommendations for trying to minimize that effect. But definitely outdoors is better than indoors, and that circulation and ventilation is something that needs to be considered.
Great, thank you. Dr. Cerise, let me turn to you. We've had some questions that people are asking, as they hear all the different medical terms, people asking about antibodies and what does that mean if someone has antibodies. And then folks have also asked about potential false positives. So any insight you can share on those topics?
Okay, I'll go quick, Justin. So antibodies, we can test for antibodies now. A lot of different tests on the market. They're still getting worked out in terms of, which ones are reliable or not. We have a test at Parkland that, has good sensitivity and specificity. The problem is we don't know what those antibodies mean yet. I mean, we know that it means you've been exposed, but are they protective? And so there's some viruses that if you've got them, you had them as a child, you got antibodies, you're protected through life. This one, we don't know. And so we're not using that antibody to say you're safe or you're protected, you couldn't get reinfected. And so we have testing, but we're not using it to screen or to look at the population. In terms of the other one was false positives, and false positives is basically, a character. The number of false positives is a factor of the testing sensitivity and specificity. So how good is the test plus the prevalence of disease? If the prevalence is low in the community, you're going to have more false positives, even with a good test. And so this is why we just don't screen mass populations for things where the prevalence is low. And so, for example, if the prevalence of COVID is 5% in the community and you have a test that's got 95% sensitivity and specificity, half of your positives are going to be false positives. And so it's a factor of how common the disease is in the community. Even with a good test, you can have a lot of false positives. And so there are strategies to double test if you're really concerned about populations, and you got to get an accurate answer. But in general, that's why we're not just mass screening everybody that doesn't have symptoms.
Great, thank you. Well, as we wrap up here, let me turn to our two experts, and I'll start again with you, Dr. Cerise. While your mic is hot there, just share with us any final thoughts and what you've learned from this pandemic, and any advice as we safely return to the new normal. And then same question to you, Dr. Wong.
So, a big thing I've learned is things change. And so, like I said before, something that we say today, next month could be different, although I think we're learning a lot, and we've learned a lot over the past couple of months. So communicating what we know in real time is important. And so I think what you guys are doing with these town halls is great, and it's really important, so people get up to date latest information. I do think this is going to be something we're living with for a while. We've looked at patterns, and when's it going to go away? We don't know, but certainly behavior to this point has been, this is something that short of a vaccine that's incredibly effective and or a cure that we don't have right now, we're going to be adapting like you're doing right now, because we're going to be adjusting to living in the time of COVID.
And I mean, my lessons learned very similar. Definitely things changed. It's an evolving situation, and especially with a novel virus like this, where it's never new, and we don't have any immunity. We don't have any treatment. We don't have a vaccine, and we're learning about all these different characteristics, how easily it's transmitted. All these things continue to evolve. I mean, the other thing that I'd say is just, and appreciate, how it takes all of us working together to address this. And again, one of the things, I mean, the partnership and Fred and Parkland have been so incredibly important to protecting our community. I just can't overstate that. I mean, they have been such a great partner, but all the other partners in our community that are working on this, because there's so many aspects of what we have to do, whether it's the testing, whether it's the contact tracing, but also reaching to all the community partners and all the different elements, various neighborhoods, and that each have their own ways of getting these messages out, getting the, being culturally aware and competent regarding how we give the messages, and appropriately, getting people to understand what's going on, and understand, why these things like cloth facial coverings and washing your hands, why these are important, and how we implement and get people to really practice these preventive measures. But it is a whole team effort, and again, appreciated the partnership with the city and the state and the feds that have been supporting us all, and again, all the community partners and Dr. May. We've been talking about a lot of different things on this, and, but whether it's nursing homes, whether it's the jail system, whether it's there are just so many pieces of this, and everyone has to be together, and so that's another lesson.
Well, thank you both so much for your perspective and for joining us in this conversation. Certainly our employees have been excited about the opportunity to engage with both of you. And so as we reach the clock here, I'll turn to you, Dr. May, but also just, again, want to thank everybody for taking part. Keep sending your questions in. Sorry, we were having a little bit of issues with the cameras fading in and out. But as one of my friends texted me, they don't really care about seeing our faces. They want the information. So hopefully they've been able to see that, and knowing that we all have faces for radio anyway. But Dr. May, I'll turn to you for closing remarks. But as you do that, one of the things that is obviously very new and different for us this year is we're having a virtual commencement. So share your thoughts on that.
Sure. Thanks for mentioning it. And I'm really excited about the commencement on the 13th. We felt like initially it was really a substitute for kind of the real thing, but as we've gotten into it, I'm really excited. Discovered, this is actually Mark Cuban's very first commencement address. And you would think with all the speaking, the events, the television shows, that he would have done this. And he is excited about that opportunity and really honored. So, and it will be great to come together to support our 8,000 graduates this year that will be part of that commencement. So I hope you'll join in, be a part of it. I'm looking forward to it. And we really have a great opportunity to celebrate our students. Dr. Huang, Dr. Cerise, thanks again. I appreciate you so much. Obviously, I get the benefit of talking to both of you on a regular basis and picking your brains and getting insight. And thanks for sharing it with all of our good friends. We had about 1,300 people join us today for this, so I appreciate all of you. Obviously, interest is high. For more information, look at our COVID-19 SharePort site. We keep that up to date, and I hope you'll join us on June 25th at 10 a.m. Be with me on that date, Dr. Michael Hinojosa, Superintendent of Dallas ISD, as well as Linda Ellis, who is the interim superintendent at Grand Prairie ISD, two of our key partners, and they're going to be talking about what's happening in their space and the partnership and what the implications going forward are. Also, look at the brief survey when you sign off. Hope you'll fill that out. That's been incredibly helpful to making sure that we put together the right information. Again, all of you, thank you so much. Thank you for doing what you're doing every day to support our students, to help our employees, and meet the needs of the community. Have a great day and the rest of the week. Thank you so much.